Okay, so that's lesson 4, and hopefully you've done the quiz. So let's review some key take-home messages. Listen to your body. You know it best. Monitor how your body feels while you're exercising and the period of time after you finish exercising. If you experience increased pain or discomfort while you're doing a particular exercise, stop. Leave that one out and talk to your physiotherapist or your exercise professional to see if there's ways that you can modify that exercise or replace it with a different one. If after your whole exercise session, you're in discomfort or pain for more than a couple hours after the session, it's also a good idea to modify your exercise, maybe do a little less next time, or again, talk to your healthcare team member or exercise professional to get some advice on how you can adjust it so you don't have as much discomfort afterwards. It's really important to use proper techniques. You can reduce your risk of discomfort or your risk of injury or stress by having the correct form. And this is where working with a physical therapist or an exercise provider who has experience in arthritis will also be able to help you do the activity in a safe, appropriate way so that you don't risk injury in your joints. That's particularly true when you try equipment at a gym that sometimes requires some awkward or difficult starting positions to perform correctly. Working with someone who has some skill in that area can help you set it up so that you're going through the motion safely and determining if that piece of equipment or machine is right for you. Other ways to stay healthy while exercising and reduce your risk of injury or discomfort are, of course, to stay hydrated when you're exercising, wear proper footwear. Even if you don't need orthoses or orthotics inside, good supportive footwear is really important. Modify the grips or use nice little devices out there that can help to protect your hands and increase the grip or friction on things like hand weights or on pulleys or anything where you have to grip the piece of equipment. Sometimes people use simple things like some foam pipe wraps to enlarge the grips and put less strain through the hands. Again, someone with experience in exercise and arthritis can give you some tips, and you can also learn from your exercise buddies what works for them. And when you're done with an exercise session, cool down slowly. Don't just stop. It's important to maybe do some light aerobic exercise to help sort of slowly decrease your circulation, slowly reduce your heart rate. And this can help prevent sort of pooling in the extremities or your legs. It also helps to relax the muscle and bring down the tone in the muscle. And you can further help this by doing some gentle stretching. Nice static stretching where you hold a stretch for anywhere from 20 seconds up to a minute on each of the main muscles that you work, especially after a strengthening session. These tips will all help in keeping the exercise session for you safe and enjoyable.